Now, the PET scan, one of my favorite names, it shows you that radiologists have a better sense of humor, okay, and a better thought pattern because they have CAT scans and PET scans. So it's much more exciting than a lot of other things because the PET scan, positron emission tomography, positron. Wow, and look at that too. The PET is finding positive things. Wow, these are happy people. Positron emission tomography is based on the concept that cancers have a higher metabolic rate of glucose. Now, if you have some enlarged lymph nodes, let's say that I have a cancer here. Now, let's say you have a cancer, because I don't want it. So let's say that you have a cancer. And I want to resect that cancer and get rid of that. Because if you can't operate on lung cancer, you're going to die. If you can operate on it, you might catch it and get rid of it. But if you can't operate on it, you're in bad shape. Now, if I have lymph nodes on the other side of the chest, I can't get rid of operate on that cancer because there's just no point in operating on a cancer that's there if I have cancer on this side. So sometimes you have small lymph nodes that look normal in size on a CAT scan, but really have cancer inside them. Sometimes you have large lymph nodes that are big anatomically on a CAT scan that look cancerous, and they have no cancer inside them. Now, if you have a small lymph node there with cancer, and I operated on you, I just took 2 or 3 weeks of your life that you have left and put you in the operating room and made you sicker. And I only made your life worse because this lymph node might have cancer. Now, if you have a big lymph node that looks cancerous, this would be my biggest interest, a big lymph node that looks cancerous but doesn't have cancer, and you didn't operate on them, saying, why operate? You got cancer on that side, and you didn't operate, they will die. So a PET scan tells you this issue. Do you have cancer in that lymph node or not? If there's cancer in it, the cancer will have increased uptake of 18-fluorodeoxyglucose. And it will light up. You might have a small node that has cancer. You might have a large node that has no cancer. If you have lymph nodes that look large and the PET scan shows no cancer, operate and cut out the primary tumor. So the PET scan is very useful to answer this question. Metastatic cancer, yes. Metastatic cancer, no. Residual cancer after surgery, yes. Residual surgery after cancer, no. Because CAT scans, MRIs can only tell anatomic enlargement. They can't tell the exact content of what's in that anatomy. But Conrad, you said the radiologic test is never the most accurate test. Now that's mostly true, because although this is accurate, it's not as accurate as actually biopsying the lymph node. The biopsy of the lymph node is the most accurate test.